Congratulations, you're probably watching this because you've been found to be suitable for laser vision correction, specifically PRK. Of the many thousands of PRK procedures performed at Laser Eye Centre, the vast majority of our patients achieve a dramatic improvement in their vision. Like all refractive procedures, PRK is considered to be elective surgery. This means that you choose to have the procedure because you want it, not because you need it. So you need to be sure that your expectations are realistic. Keep in mind that refractive surgery may not be as accurate as a well-prescribed pair of bifocals, multifocals or contact lenses, and your decision to have PRK requires you to weigh up the advantages of this procedure against glasses or contact lenses. PRK is now a well-established procedure of choice worldwide to correct refractive errors. This precise eye surgery uses scanning laser technology to shape corneal tissue. From our experience, most patients see a dramatic improvement within 2 weeks of treatment. We expect about 90% of your visual recovery within 7 to 10 days. There may also be some intermittent quality of vision issues for days or weeks during the healing process. These side effects are usually mild and temporary, but the overall risk of having a serious complication from PRK surgery is much less than 1%. Let's look at those risks. Dry eye can occur. In its mildest form, the condition affects the majority of patients and is thought to be more common when the dry eye is present prior to surgery. The most common complaint from people is the fluctuating vision, which improves after using artificial tears. Less than 1% of people having had PRK have persistent problems with dry eye following the procedure. Occasionally, your eyesight problem might be slightly undercorrected after laser vision correction, resulting in a minor defocus. This is predominantly a result of a variation in the way your eye heals. If the error is minor, it is hardly noticeable. If it impacts on the quality of your spectacle-free vision, a simple enhancement procedure can be performed. If a treatment is needed to enhance the positive results we know this procedure can achieve, then we gladly do the enhancement procedure free of charge. Overall, the enhancement rate in the clinic for all corrections is 5%. After surgery, it's normal for the eye to want to move back to its original prescription. We call this regression, which we anticipate. But if your vision regresses more than usual, you may consider an enhancement procedure or a thin pair of glasses to correct this. From our experience, serious regression affects only about 1 in 300 patients. A small number of patients experience a slight loss of visual sharpness compared to their prescription with glasses before surgery. If this loss of best corrected vision occurs, you will lose the ability to read the bottom 1 or 2 lines of the eye chart. In some cases, the sharpness you're used to returns over a period of 6 to 12 months. Only about 1 in 500 patients experiences a noticeable loss of their best corrected vision. Just as with contact lenses, some PRK patients report noticeably dimmer vision at dusk and under poor lighting conditions. This is rarely noted by patients with the usual degrees of myopia and is known as a reduction in contrast sensitivity. It is noticed more in people with higher refractive errors. Rarely do these symptoms prevent a patient from night driving, and the majority of patients do not report any night vision symptoms, with significant night glare affecting only 1 in 200 patients. Probably the greatest risk during the first 72 hours following the operation is infection. To help prevent this, you'll be given antibiotic drops during and after surgery. In addition, the eyes and eyelids, we will not operate on any at-risk patients, such as those with poorly controlled diabetes or those with active infections elsewhere in their body. Through this diligence, we've not had a case of infection in over 10,000 cases. Indications from overseas clinics are that the incidence of infection is very low, in the order of 1 in 5,000. In the event of a very serious, complicated infection, there's a 1 in 4 million risk that this infection could lead to the loss of vision. One of the possible complications is hazing of the cornea. This may be precipitated by UV light or a natural process as a byproduct of the increased rate of metabolism. When seen in the healing patient, we usually increase the dosage of topical steroid drops and closely follow the patient. Most often, this treatment will reduce or eliminate the haze and the patient's vision will be fine. A long-term complication of PRK is corneal ectasia. This refers to the forward bulging of the cornea that results from thinning associated with PRK. It has become obvious that there are predisposing factors to ectasia which lead to a return of the person's myopia and astigmatism to a degree which requires glasses, contact lenses, corneal cross-linking, or even corneal transplantation. However, this is very rare. At Laser Eye Centre, we will carry out all tests necessary to ensure that your cornea is suitable for PRK. PRK surgery is done on an outpatient basis, with most people returning to their normal activities within 4 to 6 days. On the day of surgery, you will need to be accompanied to the centre. The entire visit will be approximately 1 hour, with the actual treatment taking around 20 minutes. We begin by placing local anaesthetic drops in the eyes. You experience no pain during the procedure. There may be a stretching sensation of the eyelids caused by a small retractor that keeps the lids open. You are positioned under the operating microscope for treatment. The first step of the procedure is to place a sterile sponge with 20% alcohol on the surface of your cornea to soften the epithelium. This layer is like the skin of your cornea. You'll then see a shadow moving across your cornea while the surgeon is polishing those skin cells off. This step takes about a minute or two. The next step is to change the shape of your cornea with the excimer laser. You won't feel or see the laser beam, but you will hear a loud buzzing noise for about 20 to 60 seconds, and you may notice a smell. Another sponge with an anti-scarring agent, mitomycin, will be put on the surface of your cornea for 10 seconds. Then antibiotic, anti-inflammatory, and a drop that dilates your pupil will be applied. At the end of the procedure, the surgeon puts a normal contact lens for protection on the surface of your cornea. This contact lens will be removed after 4 or 5 days when the epithelium has grown back over the surface of your cornea. The surgeon will advise you as you progress through the procedure. If you are having both eyes treated, the surgeon then proceeds to the second eye. Once the PRK procedure is completed, your eyes will be checked to ensure that the bandaged contact lens has not been dislodged. PRK has been performed on millions of people all over the world, and 96% of our patients with a refractive error in the low to moderate ranges achieve functional normal vision. Patients who fit into the high or extreme category of refractive error can expect to achieve a dramatic improvement in their natural sight, but are more likely to need an enhancement to achieve the total independence from corrective eyewear. No matter how routine the surgical procedure, the decision on whether or not to have PRK is an important one, and ultimately one that only you can make. To put things in perspective, keep in mind that patients have been treated for over 30 years with similar techniques and are still enjoying visual freedom to this day. PRK has evolved through the ongoing advancement and refinement of these techniques. By changing the curve of the cornea, this treatment is capable of lasting a lifetime. Most patients notice a dramatic improvement, providing a lifestyle with no dependence on glasses or contact lenses.